Hi everyone, just wanted to go over our work from last week and then talk briefly about this week as well. So in week 7, our focus was on long-term care. So hopefully you got a good idea of the kind of the issues faced in long-term care overall, and how policy can impact that. As you've seen in the textbook, we've talked about it in other classes. The population is aging rapidly. I mean, obviously, we're all aging at the same pace, but I think that there's a stat, I think in one of the texts or somewhere, that in the next 10 years a quarter of the population of the United States will be over 65 years old. So certainly a lot of folks will fall into that age bracket, and as you reach your later years, 65, 70, 75, 80 years old, you start to need long-term care services. So this article here that was in the classroom, I thought was pretty neat, kind of wrapping up some of the issues and aspects of long-term care from a policy perspective that can really have some impact with some changes for that. So it talked about stabilizing the long-term care insurance market. For those of you that work full-time, you're probably aware of this. For those of you that are full-time students and haven't been in the workplace full-time yet, there is really there are long-term care insurance policies, but it's not the type of benefit that is commonly offered by every employer, and different from health insurance, where with a health insurance, the employee will pay a portion, but the employer pays a much larger portion typically. With long-term care insurance, even if your employer offers it, it's typically fully out of pocket for you as the employee. So it can be very, very expensive. So there are some notions in here about how to assist with that. Also, strengthening the coverage for long-term care in both the Medicare and Medicaid program. Medicare only pays for skilled care in a facility. So if you are in a non-skilled nursing facility or in assisted living or something of that nature, some services are covered for you in those settings. For example, if you need physician services or physical therapy, those types of things. But your room and board is not covered like it is in a skilled nursing facility. And even with skilled, it's only a very limited portion of time that they'll pay for. So Medicaid typically picks up the bill for the majority of care outside of a skilled nursing facility, and that varies wildly, but by state. So I'm sure you guys have probably heard this story in the past, but my father-in-law, he had to be placed in long-term care. He was in New York because that's where he lived, where we used to live in New York. And unfortunately, we wanted to bring him to Pennsylvania to be nearby us, because at the time we were living in Pittsburgh. But unfortunately, Medicaid in Pennsylvania does not pay for skilled, or does not pay for assisted living facilities, what are known as personal care facilities in Pennsylvania. They actually do pay for assisted living, but it's not the same thing in PA as it is in New York. So they don't pay for the type of facility where you don't need around-the-clock nursing care, but you do need regular care throughout the day for your activities of daily living. So he had to stay in New York. He was able, his income was limited to a pension and his Social Security. So with what's known as a spend down, he was eligible for New York State Medicaid, which is honestly one of the most robust Medicaid programs in the country, second only to probably Massachusetts, which we learned about in class, who has a very robust program. But he was able to take part in the Medicaid program, which covered a good portion of his room and board in the facility, and then they just took all of his payments every month. So all of his Social Security, all of his pension payment went directly to the county who runs the Medicaid program. So it's really a sad situation that we put people in. We couldn't. It seems like in the realm of like the $8,000 or $9,000 a month to place him in Pennsylvania. We left him there in New York, and at least it was financially feasible. But it creates a very sad situation for families, for every all around. It's just to have some more consistency state to state in what's covered under Medicaid, and to even create a consistency in definitions as to what facilities are. They're the same facilities, they're just called something different based on the insurance program. So the last thing to mention, support for caregivers, either family or maybe just friends or whomever is the caregiver. They're encouraging folks as they get older to age in place. So aging in place means staying in your own home instead of going into a facility, but staying in your own home with family caregivers or with professional caregivers from home health agencies. There's lots of different ways that that can happen, but unfortunately, it is sometimes takes a great toll on the caregivers. If you want to go away on vacation, or if you want to, or if you, even now with COVID, think about a family that maybe had an elderly family member that was living with them, but the mom, dad, whomever had to go to work, and they had the potential of bringing COVID home to that family member, or kids that lived in the household were going to school and had the potential of bringing it home. So it really creates a negative situation in some areas, and then financially, it can obviously also be problematic. So there's certainly, from a policy perspective, with regard to long-term care overall, there are quite a few things that can be done, and hopefully we'll see some of those things move forward in the new administration. So, in week 8, we are going to look a little bit at policy evaluation. So we've worked all throughout the term to, okay, let's create policies. How does that happen? How do policies get formed in different ways? Lobbyists, the legislature, all of these different areas, state, county health departments, etc. Now, once we've implemented the policy, which we've also talked about as well, how do we evaluate it? How do we know if it's working or not? And that's really a key component as well. So we have some reading with regard to that this week. We have a discussion question about evaluation this week as well. And then we also, don't forget, because we're not doing the live sessions this week, we do need everyone to post a recording of their presentation. So you can do a narrated PowerPoint, you can do a recording of a Google Meet session, you can just make a video on your phone and upload it to YouTube, whatever you want to do, 3 to 5 minutes maximum. Just briefly discussing your policy brief. And Screencast-O-Matic is another option that people are using. I actually just tried to use it on my other computer to record this, and it didn't work. So hopefully it's just a fluke with that computer. I've been having problems with it. So Screencast-O-Matic is an option, or even within PowerPoint, there's an ability to add narration to the slides. So whatever works for you is fine. Upload it here to this section. You'll click on this, and it's like a blog section. So we can see that Amanda, thank you. You already uploaded yours yesterday. So everyone, you'll be able to see everyone's here, and you can just click on them, and you'll be able to take a look at it. And please take a look at, at least a couple of your colleagues in class, take a look at their presentations, and then make some comments. Like here, I can make a comment. I haven't watched Amanda's yet, so I'm not going to comment yet, but I can make a comment on it and provide her with some feedback. You could ask questions. You can, you can just make a comment based on what they did or whatever. So please take the time to do that. Everyone's put a lot of work into these, and I think that it would be great if everyone can at least look at a couple of them. And that's it. You have a quiz this week. It will be posted later today. You have your Ed puzzle, which is this. So so that's it. Sorry about that. My phone rang. So that's it for this week. That's obviously it for our class. I appreciate everyone's hard work this term. Hopefully you learned a little bit about health policy, and how we can impact health policy, how it's made, etc. And everyone, please have a safe and healthy holiday season. Now is not the time. I know there's a vaccine out, and so very few of us are going to get that for a while. So please remember, stay vigilant, masks, hand washing, social distancing. We don't want the same thing to happen after Christmas as is still happening from the Thanksgiving debacle. So, we want to be able to have a good new year coming to us, and hopefully get those infection rates down. So everyone have a great holiday. Enjoy your little bit of time off, and we'll see everybody in the spring. Okay, thanks so much.